My name is Doug White. I'm an associate professor of critical care medicine and director of the program on ethics and decision-making in critical illness at the University of Pittsburgh School of Medicine. A number of studies have shown that misperceptions about prognosis by surrogate decision-makers in ICUs are common. Our goals were to determine how often physicians and surrogate decision-makers in ICUs have different expectations about patients' prognoses, and to understand why these differences existed. We conducted a prospective mixed methods cohort study at 4 ICUs at the University of California, San Francisco Medical Center, involving 229 surrogate decision makers and 99 physicians who were involved in the care of 174 critically ill incapacitated patients. After patients had received 5 days of mechanical ventilation, we asked physicians and surrogates to independently record their expectations about the patient's chances of surviving to hospital discharge. We asked surrogates what they perceived to be the physician's prognostic estimates. We invited surrogates to participate in a semi-structured interview to help us understand why their expectations about prognosis differed from what they thought the physician's estimates to be. Our main outcome measure was the proportion of cases in which physicians and surrogates had at least a 20% difference in their prognostic expectations. In roughly half of cases, surrogates held a substantially more optimistic expectation about prognosis compared to the physicians, and the physicians' prognostic estimates were significantly more accurate. We also found that in almost all of these cases, surrogates had some misunderstanding about physicians' prognostic expectations. But we also found that in about half of the cases, surrogates held beliefs about prognosis that differed from what they heard from the physicians. Some surrogates reported a belief that maintaining a more hopeful or optimistic prognostic estimate would actually help the patient's chances of survival. Some surrogates reported that their estimates were more optimistic because they believed the physician did not know about the patient's intrinsic strength and will to live. Some surrogates held religious beliefs that influenced their prognostic expectations that differed from what they perceived to be physicians' more biomedical expectations. We concluded that differing expectations about prognosis between physicians and surrogates in ICUs are common and arise not only from misunderstandings, but also from surrogates holding different beliefs about prognosis compared to the physicians. We're currently conducting a randomized controlled trial of an intervention to improve both the comprehensibility of prognostic information for surrogates and also to attend to the emotional and psychological considerations that influence surrogates' prognostic expectations.